The first 24 hours are the most dangerous in a child's life. For a woman, giving birth can be life-threatening. Due to a huge multinational effort over the last decades, a large number of women and children are today surviving. Only in India, more than 1.5 million children are dying every year. The majority dies of causes that easily could have been prevented. The cooperation project Norway India Partnership Initiative, NIPI, was started in 2006 to support the Indian government in their efforts to improve healthcare for women in rural areas. NIPI programs are now established in 4 Indian states. In this hospital in Alwar, in the state of Rajasthan, doctors are taking care of the premature and most vulnerable babies, as well as attending to mothers giving birth and their newborns. Dr. Yadav has dedicated his life to this work.
We have focused in improving, and we had worked on the policy of continuum of care, taking care of the mother, taking care of the child since the mother becomes pregnant, throughout the period of the antenatal, then natal and the postnatal period. The taking care of both the mother and the child was so important to bring the mortality of infants as well as the mothers.
Within the hospital, the women are greeted by the pink-clothed Yashodas. They are village women who have been given a brief education to be able to help mothers with information about childcare, nutrition, immunization, and above all, breastfeeding.
The breast initially within 1 hour, which is very low in our state, that was hardly 10 to 15%, that has gone up to 95 to 100%. So now we can say that almost every child are put to breast within 1 hour of the delivery. Now every child is given the birth vaccinations, and that rate is almost 100%.
In the rural areas, the NIPI project has several eager helpers. They are called Ashas and go by foot from village to village. Their objective is to convince as many women as possible to give birth in a hospital, not at home. They also examine pregnant women and visit mothers and their newborns. Sakunat Mubin in the village of Bahala has just arrived from the hospital with a little daughter. Sakunat has been given birth at home several times with severe complications. If the Asha has not brought her to the hospital, she might have died during giving birth.
हाँ सर, बहुत ही बचाया जा सकता है अब। हाँ, सुविधाएं हैं, गाड़ी भी आती है, ये नहीं आती, हमें नहीं मिली तो आती हैं, एम्बुलेंस भी आती हैं, बच्चों को भी बचाया जा सकता है, माँ को भी। एक यहाँ पहले हुई थी एक डिलीवरी, हाँ, तो वहाँ भी उसको माँ को उसी टाइम कुछ ऐसा हो गया था तो फौरन उसको भर्ती करवाया था।
The Asha, Sudesh Kumari, has a small money award for the mother because the newborn is a girl. The number of women dying while giving birth is now reduced by 1/2, and the child mortality is reduced by 1/3. Still, there is a distance to the UN Millennium Goals and far from good enough. But for every woman surviving birth and every newborn growing up, a victory is won.